All right. Good afternoon, everyone. Thanks for joining this webinar on the health impacts of climate change. Really appreciate you joining us. We're excited for this robust program. And first wanted to start it off with introducing Congressman Ami Bera. Most of you, I'm sure, know him, but he is the congressman representing 7th Congressional District in Sacramento County since 2013. He's a doctor by trade and also serves on the House Foreign Affairs Committee and is the chairman of the Subcommittee on Asia and the Pacific, and also as a member of the House Committee on Science, Space, and Technology. And with that, I will hand it over to Congressman Bera.
Great, thanks, Philip. And I will keep my comment short because you're all here to listen to the experts, talk about the health impact of climate change. I mean, I think about my own life as a lifelong Californian. I was born and raised down in Southern California in the 60s, early 70s. And when I think about the air quality in California, there were days where you could see the air that you were breathing and you could feel that burning in your throat and your lungs. And the reason why I start with that story is that's how it was as a kid. And you still have bad air quality days, both up here in Sacramento and down in Southern California, but through federal action, through the Clean Air Act, through very intentional investments in in technology and the cars we drove, et cetera, we were able to dramatically improve that air quality. So, that was a more localized challenge. This is a global challenge when we think about the impact of climate change. And the reason why I talk about what we have been doing, if we approach this with that same focus, desire, and intensity, and I'm pleased to see President Biden make climate change one of his priority areas, we can actually do this. We can get to carbon neutrality, but then also if we invest in research technology, we can also start to turn carbon around and sequester carbon and reduce the carbon that's in the atmosphere. And, it impacts all of us, higher asthma rates, we're having hotter summers. We've seen the devastation of the windstorms and the fires that we've had up here in the Sacramento region and Northern California, but also throughout California with the longer fire seasons. We're going into a second year of a drought, and these droughts are becoming more severe and more frequent. And then just if we step back from the global level, you're seeing mass migrations, mass food insecurity around the world, et cetera. And you can even argue that some of the frequency of new emerging pathogens, pandemics, et cetera, will become more frequent because of a changing climate and a warming planet. So there's an urgency of now. I'd like to just thank the Citizens Climate Lobby. I'd like to thank the American Lung Association, Valley Vision, the public health experts, and UC Davis for giving of your time and doing this community service and doing this webinar for folks. So with that, you didn't come here to listen to me. So let me turn it back over to you, Philip, and you can introduce the panelists.
Excellent. Thanks, Congressman. And so for the beginning of our presentation, right before I introduce our first speaker, just want to let everyone know we are going to have a couple Q&A components, and if you can utilize the Q&A function on the webinar, we'd appreciate that. Many of you did submit questions with your registration, and we have those as well. Additionally, many of you have received a rough agenda from a follow-up email I sent either last night or this morning. So I encourage you to look at that. But without further ado, we're going to get into our program. Our first speaker is Dr. Tom Suchanek. He's a marine ecologist and emeritus scientist from UC Davis. He spent most of his career conducting research on environmental contaminants and is now addressing the most critical contaminant of our time, carbon dioxide. He'll be giving an overview presentation on global and local climate change impacts and the urgency to develop solutions to solve this crisis. So I will go ahead to Dr. Suchanek now.
Well, thanks, Philip, for that nice introduction. And thank you and Dr. Bera for inviting me here today. What I'd like to do today is to give a very brief overview of climate change globally and some examples of how that affects us here in Sacramento, as well as show you the urgency of addressing our climate change crisis. So with that, let's begin with the basics. And the basics are the greenhouse effect. Here is the natural greenhouse effect on the left and the human-enhanced greenhouse effect on the right. The sun beats down on the earth. Some of that heat is absorbed by the earth. Some of it's reflected back out into space. However, because of some of these greenhouse gases, carbon dioxide, methane, and nitrous oxide, that puts a little warm blanket over the earth of heat-trapping gases. Without those gases, our planet would be ice, basically. But it's not. We really rely on some of those gases, but not too much. So let's look at the human-enhanced greenhouse effect. Same process. Sun beats down on the earth. Some of that heat is absorbed. Some of it's reflected back out into space. But because we've produced and emitted so many more of these greenhouse gases, carbon dioxide, methane, and nitrous oxide, we have a much bigger blanket of heat-trapping gases. And that's the problem. That's the problem we're trying to deal with. So greenhouse effect creates global warming, which then drives climate change. Today, I'm going to focus primarily on carbon dioxide, since that's the biggest issue we have to deal with. There are other greenhouse gases besides methane and nitrous oxide as well, but today we'll focus primarily on carbon dioxide. So fossil fuels and the emissions of fossil fuels and the burning of fossil fuels, carbon dioxide, coal, oil, and gas are responsible for about 94% of the total carbon dioxide emissions from human sources. And coal represents about 42% of those emissions, oil 33%, and natural gas 19%. Cement plants also add another 6%. So the global community has been emitting about 100 million tons of carbon dioxide every day into the Earth's atmosphere. And that adds up to about 40 billion tons of CO2 per year. Now that's almost incomprehensible, because CO2 is a gas. I mean, how can it be possibly that much weight or that much mass into the atmosphere? But it's true. If we add on the other greenhouse gases besides carbon dioxide, we end up with about 51 billion tons per year, an enormous, enormous amount. So that's what we have to deal with. So let's look at the sources of greenhouse gas emissions in Sacramento County. First, we have transportation. Off-road and on-road vehicles releases about 40% of our greenhouse gases. And next in line is the residential energy usage, about 25% of our greenhouse gases. And finally, the next one in line, 18% for commercial and industrial manufacturing. So those are the main things we need to worry about when we're looking at climate action plans. So let's go back in time a little bit and talk about carbon dioxide. On the left, we have carbon dioxide concentrations in parts per million. And on the bottom, we have time all the way back to 800,000 years before the present. So this yellow line up and down represents carbon dioxide fluctuations over time. Every time it dips down, that's another ice age. And we continue along that line until about 200,000 years ago, when humans first appeared. As we go then towards the future, where we are now, about where we are now, we encounter the Industrial Revolution, which started about 1800, where we started burning coal to drive our machinery and the steam engines. And then from there, you can see visually, it's just gone straight up to about 415 parts per million. That's not a special number. It just shows you that it's going exponentially higher and higher all the time. And that's what we need to stop. So let's take a look at the relationship between temperature and carbon dioxide. So on the left, we have temperature increase since the Industrial Revolution, and that's going up to about 1.2 degrees Celsius. And on the right, we have the concentrations of carbon dioxide, like I said, 415 parts per million. So as carbon dioxide, which is the white line, increases over time, it goes up almost exponential here. And then the temperature, which is in the blue line, is quite variable, but it's also correlated with carbon dioxide, increasing all the time. The last time concentrations were 415 parts per million of CO2, humans didn't even exist. That was 800,000 years to 20 million years ago. And global temperatures at that time were substantially higher. There was almost no ice on the planet. and sea level was 100 foot higher. Now, I think most of you know that Sacramento elevation is about 25 feet above sea level. So where would your house be if we had 100 foot higher sea level? Think about it. So here we have the 10 hottest years on record globally, with 2016 being the highest temperature there. If we add 2020 on there last year, it was equivalent to the hottest temperature we've incurred on Earth so far. So both of those are going higher and higher all the time, and we need to stop that increase, which has lately been causing rolling blackouts because the electrical system is failing because so many people are trying to use their air conditioners. So this is part of the problem. In Sacramento, we encounter tremendous heat in the summer, sometimes 100 to 110. The highest temperature in Sacramento has been 115 degrees. That's really hot. But the hottest air temperature recorded on Earth was just this last August, 130 degrees in Death Valley. Now, I don't want to see much of that happening anymore. However, if we continue on emitting and exposing carbon dioxide and other greenhouse gases into the atmosphere at the rate we're going now, by the 2040s, it's expected that Sacramento will be experiencing a 128 degree temperature. That's something that I don't think any of us really want. And with the heat comes drought. And this is an example of a drought in 2012 to 2017. You know that we're in a drought situation now. And let's take a closer look at California over here. This is California, and there's different levels of drought. There's abnormal drought, moderate drought, severe drought, extreme drought, and that last category, exceptional drought. Now, until this drought here in 2017, this exceptional drought category didn't even exist. Scientists had to create a new metric and a new color to even describe this drought, this level of drought. Now, I didn't show the example, but you did see it in the splash slides initially. This condition of this level of drought with the exceptional drought is expected this summer. It's there now, and it's expected to continue. Let's take a look at wildfires greater than 1,000 acres on Forest Service land. On the left, we have the number of fires. Each one of these bars is 1 year. And on the bottom, from 1970 to about the present. And you can see that in the 1970s, there wasn't much going on. Well, we had a few fires, 50 fires or so. But as we come closer to the present time, it's highly variable. However, this orange line is the running average of all of the abundance of fires. And this just keeps going up, and it's trending towards an exponential increase. Besides that, California's fire season has increased by 75 days across the Sierra Nevada. That's both earlier than the present and then later than the present, or what was the present. And who knows, one day we may have the entire year being a California fire season. So we need to be careful about what we're doing. So let's take a look at those fires. In 2020, we had over 9,900 fires in California. That's just phenomenal. And the firefighters were fighting 5 of the 6 largest California wildfires in recorded history, all at the same time in September. So in terms of acres burned, these are the 5 largest acres burned years. CAL FIRE data shows us that about 3.2 million acres were burned last year in 2020. But if we now add the US Forest Service data onto that, it's really 4.2 million acres burned. And we're expecting similar effects this coming summer. So where there's fire, there's smoke. Absolutely. And that smoke is what's affecting us. I'll give you a couple examples. This is the Woolsey fire in Malibu in 2018. This is when they had to close Route 101 because there was so much smoke on the road you couldn't see where you were going. Tremendous result of that fire. And here's Sacramento Tower Bridge on a good day. Here it was last summer when we had that tremendous, in September, had that tremendous air quality damage to us. And let's take a look at that air quality index, which goes from 0 to 500. Here's a map of Sacramento County. If we take, in kind of odd shape, but if you take this map and plop it right on top of this right-hand area, this is the Sacramento right in the middle. We take a look at the actual air quality indices. The red area is unhealthy air, air quality 151 to 200. The purple area is very unhealthy air from 201 to 300. And that brown blob up above is hazardous air, 301 to 500. That's when we were told to stay inside, get filters for our house if we could, don't exercise, don't go out and bike. So that was a tremendous time on September 12th of last year where we were really suffering from the smoke. But it's not just smoke from forest fires. Scientists from Harvard University just published a paper recently showing that the exposure to particulate matter, and that's PM 2.5, that's particulate matter in the 2.5 micron range, that's microscopic, accumulating in people's lungs from fossil fuel emissions, burning fossil fuels specifically, not forests, accounted for 18% of global deaths in 2018. That's over 8 million deaths that year just from the burning of fossil fuels. So that's something that we really need to do, is to get rid of these things. So what's our solutions? We have many solutions. I'm only going to touch on a couple today. We don't have time for all of them, but we need to transition into alternative energy sources, and we need to reduce and eliminate fossil fuel use. So let's take a look at that. One of our best options right now is solar, with an endless renewable resource, right? Well, not quite. Our sun is only going to be around for about 4.5 billion years. So we really need to get this thing going and solve this crisis. So the US relies on about 2% of solar for their energy needs, but California is a little ahead of the game. We rely on 20% solar for our energy needs. And the good news is that this is mostly from photovoltaic cells on rooftops, but the cost of photovoltaics has gone down 99% from the 1970s, and it's actually still going down now. The second option for us is wind. So 5% of the world's energy comes from wind, but 7.5% of our energy in California comes from wind as well. Most of that is land-based wind turbines, and this is probably more familiar to most of you, the Altamont Pass wind turbine farm, which is one of the oldest and at one time the largest wind turbine farm in the world, not anymore. But in addition to land-based wind turbines, we have the option for offshore wind here. There's been a bill submitted to the Assembly in California to require some level of offshore winds. We have tremendous winds on the coast, which could accommodate this. So they're talking about doing prototypes up in the northern coast. So we need to electrify everything, especially transportation. Remember, I told you that 40% of California's carbon emissions are coming from transportation, but it's only 28% in the rest of the country because California has so many more cars, we're producing that much more carbon dioxide into the atmosphere. But good news, Governor Newsom signed an executive order last year in September to halt the sales of all new gasoline cars and trucks by 2035. And also good, January 25th, President Biden set a goal to convert the entire federal fleet to electric vehicles. That's great news. And 3 days later, General Motors announced it will only sell zero-emission vehicles by 2035. This is really gaining a lot of momentum right now. And over a dozen countries have committed to banning new gasoline automobiles over the next 1 to 2 decades. That's fantastic news. We just need to keep on that and move faster if we can. So I'm gonna walk you through this graph. It looks complicated, but it's not. This is the same graph I showed you before of the axis of billions of tons of carbon dioxide being emitted into the atmosphere, up to 40 billion tons a year. On the bottom is a time from 1980 to about 2100, the end of the century. So this black line is the annual increase in carbon dioxide emitted into the atmosphere. So if we started in the year 2000 to limit our carbon dioxide, we would have only had to reduce our carbon dioxide emissions by 2% per year. Well, obviously we didn't do that. We kept going higher and higher and higher, and here we are now in the year 2021. If we start now, we will have to reduce our carbon emissions by about 5% per year. Now, each one of these little lines is a model run indicating how fast we would have to reduce those emissions. So in 2000, we would be one of these yellow lines. In the 2021, it would be this red line going down here until we get to the place where we want to be, which is zero emissions. So now we're here, but here's 2030. If we wait until 2030 to start this process, we would be at that blue line there. And that would mean that we would have to reduce our carbon emissions into the atmosphere by 9% per year. That's almost unfathomable. I mean, we would have a really hard time doing that, plus having to have all the other countries of the world basically do the same thing. So I'm very pleased that Biden's goal was set on Earth Day last week to lower greenhouse gases by at least 50% by the year 2030 and have net zero greenhouse gases by 2050. So those are our goals, and hopefully we can accomplish that. So at this point, we have this situation going on with 3 crises all at the same time. Here's COVID-19. We have 1 to 2 years. We'll probably be dealing with this. The economy is in recession. We have a totally unstable situation where the stocks are going up hundreds and hundreds of points each day or down hundreds of points. We're probably going to be dealing with that for 2 to 4 years. And overwhelming all of this is climate change. We're experiencing those extreme impacts right now. And this is an existential threat that's facing us. If we don't do something about this now, this will be much huger, much bigger, and more devastating than anything else we've ever encountered. And this would go on to infinity if we don't deal with it. So an expanded presentation of this is found on my website if you're interested. So at this point, I'd like to run over this graph. I'm going to walk you through this in preparation for Kathy Dodson's presentation on En-ROADS. So on the left, we have temperature. We've sort of seen this before, increasing in Celsius degrees. And on the bottom, we have time from 2000 up to the end of the century. Now, this was the temperature back here. If we assume this green line was pre-industrial temperature, this is all increase above pre-industrial temperature. So right now, this blue line here is how far we've gotten in terms of increasing temperature since the Industrial Revolution. Right now, we've reached about 1.25 degrees. And the Paris Climate Accord goals are that we should not exceed 1.5 degrees Celsius, or at the very most 2 degrees Celsius, in order to save us from the most extreme impacts from climate change. So we're here now, and if we continue on with what we're doing, which is called the model of business as usual, and we go there to the year 2100, we would reach a point where we were 3.6 degrees Celsius above the pre-industrial revolution, or in Fahrenheit degrees, we'd be 6.5 degrees hotter. This would be devastating and cause a tremendous existential threat to human civilization. We don't want to be there. So at this point, I'm pleased to introduce Kathy Dodson from the Citizens Climate Lobby. She will be showing you a climate simulator developed by En-ROADS, which is the MIT Sloan School of Management in Cambridge, Massachusetts. And Kathy, I'd like you to take it away from here.
Thank you, Dr. Sukanik, for that great review on climate change and its serious impacts. Now that we've heard about the dire climate situation, I'd like to briefly show you some ideas on how to effectively address the existential threat of climate change. My name is Kathy Dodson. I'm a physical therapist with a master's in public health. And after hearing about the gravity of climate change, I wanted to do something, but I didn't know how I, as one individual and not a climate scientist, could make an impact on such a huge issue. I felt really powerless. A friend told me about an international group with a chapter here in Sacramento called Citizens Climate Lobby, which is a grassroots advocacy group working to create the political will for a livable world. I joined so that I could learn more and become involved. Through Citizens Climate Lobby, I learned about a climate simulator tool called En-ROADS, which took over 9 years to build. It was built by Climate Interactive, a not-for-profit think tank that grew out of MIT Sloan in Cambridge, Massachusetts. En-ROADS helps people see what really works to address climate change. En-ROADS has been used to brief US senators and representatives and their staffers from both sides of the aisle, the US State Department, and the UN Secretary General's office, among others. Because of my interest in the En-ROADS Climate Simulator tool, I completed their training program last December and am now considered a climate ambassador, able to give presentations on En-ROADS. So if you've ever thought, what can I do about climate change, or how can I make a difference? I hope I can give you some ideas in this brief look at En-ROADS. I'll start sharing my screen. So this is the En-ROADS page, and I know from experience how overwhelming it is. And today we're only going to look at a few small parts of it, so don't worry. I'll be using my cursor to direct your attention, so just watch the cursor. This demonstration will give you a small taste of what the En-ROADS simulator can do. We just heard from Dr. Sukanik about the serious effects of climate change and the goal of limiting the temperature rise by the end of the century to hopefully no more than 1.5 degrees Celsius and a maximum of 2 degrees Celsius. By the way, all the temperature measurements I refer to will be in Celsius, but you can see the Fahrenheit degrees here below. For the purpose of this discussion, you can think of Fahrenheit as roughly double the degrees in Celsius, if that helps. We see here a graph of the amount of greenhouse gases measured in gigatons of carbon dioxide equivalent per year that we are putting into the atmosphere this century, from 2000 to 2100. We see that if we continue business as usual, this line here, meaning that we use some solar and wind power and continue burning lots of fossil fuels such as coal, oil, and natural gas, we are on target to reach a very hot 3.6 degrees above pre-industrial temperatures. Remember that our goal is to limit the temperature rise to 1.5 degrees and a maximum of 2 degrees. So what can we do? Let's get started with the En-ROADS simulator and see what it can tell us on how to limit temperature rise. First, En-ROADS is a global model, not just for the United States or California, so we need to think globally when we use it. I want to show you the global sources of energy, which include coal, oil, natural gas, and renewables, such as wind and solar power, and carbon price. Now, what does putting a price on carbon mean? This means charging a fee to producers of coal, oil, and natural gas, which makes these fossil fuels more expensive. So we use more renewable energy and less fossil fuels, which just plain keeps them in the ground. This has the added benefit of cleaner air and big health benefits, which you'll hear about later from the other presenters. Just as we have the energy sources listed down here, we can see them represented up here by different colored lines and how much of them we are expecting to use throughout this century, from 2000 to 2100. The red line represents oil, and we can see that our use of oil steadily increases until about 2060 and levels off for the rest of the century. The brown line represents our use of coal, and we can see that worldwide, the use of coal steadily increases throughout the century. Coal is relatively cheap to mine and transport. The blue line represents natural gas, which is used for electricity, heating, and industry, and we see that its use also steadily increases over the century. The green line represents renewables, such as solar and wind power, and we can see that the use of renewables is expected to really begin increasing, well, right about now, and steeply increase throughout the century, so that by the end of the century, renewables will be the dominant source of energy. Okay, let's look at how we actually use the En-ROADS simulator to see the power of different policies. Look, for example, at this policy, electrification of transportation. We see that if globally we discourage the conversion to electric cars, buses, trucks, and trains, as I move the big dot along the line, a slider, if you will, we see that we're emitting even more greenhouse gases represented by the blue line, and that the temperature has increased 0.1 degree to 3.7 degrees, and we certainly don't want that. If, on the other hand, we move it in the other direction, representing encouraging and incentivizing the use of electric vehicles, the blue line shows us that we will be emitting less greenhouse gases and the temperature would drop 0.1 degrees down to 3.5 degrees. So that's how the simulator works. Let's continue looking at electrification of transportation and now focus on these colored lines, especially the red one that represents oil and the green one for renewables. And if you're able, try and pay attention to the brown line of coal also. So what happens when we help electrify transportation? Watch what the lines do throughout the century. And I'll do that again. We see that the use of oil is greatly reduced because we're using less gasoline. And because we need more electricity, this encourages the use of renewables, which really increases. There's also a small increase in the use of coal because of the rise in electrical demand. This illustrates the beauty and usefulness of En-ROADS. It takes whole systems into account and calculates the effects of one change on lots of systems such as coal, oil, and renewables, just as we saw here. Since we want to limit the rise in temperature to 1.5 degrees or 2 degrees maximum, let's look at the effectiveness of some other policies that build on this first policy change. Let's look at increasing the energy efficiency of transportation. This includes using hybrid cars, expanding public transportation, and making it safer for people to walk and bike. It also includes not only cars, trucks, buses, and trains, but also big cargo ships and planes. If we encourage this policy, watch what happens, excuse me, to the sources of primary energy. Let's watch that again. We see that the use of all energy sources decreases because transportation is more efficient and we're using less fuel. We also see that we're emitting less greenhouse gases, and we've lowered the temperature by another 0.1 degree to 3.4 degrees. Watch what happens if we use electricity instead of fossil fuels for our buildings, appliances, and heating system. As an example of this, I just received a rebate check from my utility provider for $750 because I switched my gas stove to an electric one. So watch the sources of energy again. And we're going to electrify buildings and industry. And I'll do that again. We see that this encourages the use of more renewables and decreases our use of fossil fuels. We also see that we've decreased the temperature to 3.2 degrees, another 0.2 degrees of lowering. Finally, what happens when we add making our buildings more efficient by effectively insulating them and using energy efficient appliances in our homes and buildings? This section also includes factories switching to using more energy efficient machinery. Watch the sources of energy. We see that the need for energy from all sources goes down, again, because of increased efficiency. Now we see that the temperature decreases another 0.3 degrees down to 2.9 degrees. We see that by implementing all four of these policies, we've reduced the rise in temperature from 3.6 degrees expected down to 2.9, a 0.7 degree improvement. Still nowhere near our goal of 1.5 degrees, but we're on our way. In the interest of time, we'll stop here. I hope it's clear that if we address other policy areas, we could lower the temperature even further. As you've probably realized by now, not one policy change can reduce the temperature to only a 1.5 degree rise. We use the phrase, there's no silver bullet, only silver buckshot. We need to make changes in many different areas if we are to meet our climate goals. Now I'll quickly show you the most effective policies to address climate change. The big hitters, if you will. We've seen that most policies lower the temperature by about 0.1 to 0.3 degrees, and I want to show you what setting a global price on carbon does, making coal, oil, and natural gas more expensive. Watch what happens to the sources of energy. I'll do that again. Green is renewables, red is oil, blue is natural gas, and the brown is coal. When we put a price on carbon, we see the use of renewable energy increases markedly. We see that we are using less coal, oil, and natural gas. We also see that the temperature has been lowered by 1 full degree, from 3.6 degrees all the way down to 2.6 degrees. This is by far the most powerful policy change we can make to address climate change. Other powerful policies include reducing the amount of methane and other gases that we're putting into the atmosphere. Methane comes primarily from cattle, agriculture, and leaks from oil and gas industries. And we see if we do reduce that, we could reduce the temperature another 0.3 degrees down to 2.3 degrees. Finally, if we work on carbon removal technologies, such as direct air capture, and we really incentivize these technologies, we can lower the temperature another 0.6 degrees. We've reached 0.17 degrees. We can see that enacting just these 3 powerful policies, we've reduced the temperature rise to only 1.7 instead of the expected 3.6 degrees. This is in the range of our target temperatures of a 1.5 to 2 degree rise maximum by the end of the century. So what have we learned from this short exercise? We see that we need to take many actions to address climate change. There's no silver bullet, only silver buckshot. Secondly, some of you may have reacted with surprise, as I did, when I learned that some policies that I thought would be really effective didn't turn out to have that much of an effect. But they still are important to adopt, as we will need to do many things to lower the temperature. Finally, we see that putting a price on carbon is the most effective strategy to address climate change. This has been a very short introduction to the En-ROADS Climate Simulator, which I find incredibly helpful in comparing the power of different policies to address climate change. It lets me know where I can focus my efforts. And a big takeaway for me, and I hope for all of you, is knowing that there are definitely many policies that work to address climate change. Dr. Sukanik, can you please share the resources screen? I encourage all of you to use the simulator. It's free by going to the Climate Interactive website. You will be able to compare the power of the policies that you're interested in. And if you take all of the En-ROADS training sessions, you too could become an En-ROADS climate ambassador. If you want to become more involved in addressing climate change, go to the website citizensclimatelobby.org and check out the organization. Our Sacramento chapter is very active. Feel free to contact Dr. Sukanik or myself if you or your group would like to hear more in-depth talks on climate change and on using the En-ROADS Climate Simulator. Finally, Dr. Sukanik and I would like to thank Congressman Bera and his staff for this opportunity to present information on climate change and various policy solutions.
Great, thanks very much, Kathy and Dr. Sukanik for those 2 presentations. Now we're going to go into a very brief Q&A segment. And before I do that, I'd like to introduce Adrian Wren, who's going to be our moderator for the program. Adrian is a project leader at Valley Vision. He's born and raised in rural Mendocino County and moved to Sacramento in 2014 after graduating from UC Davis. His work at Valley Vision includes management of the Regional Cleaner Air Partnership, which is a coalition of air quality advocates and regulators and industry partners who work together to advocate for clean air, as well as the Sacramento neighborhoods activating on air quality, a project with residents of North Sacramento and Oak Park to deploy air monitors to enhance air quality in the region. So with that, I'll turn it over to Adrian.
Thank you, Philip, and of course, thank you to the Congressman and his staff for holding this space for today's conversation. And of course, thank you as well to the experts who've taken the time to inform us of this important topic. So just to elevate a couple of questions that came through in the chat, one being, considering the focus on electrification, and this is to Dr. Sukanik, considering the focus on electrification, we have a question elevating concerns about the carbon emissions that are created during electricity generation. So you talked about renewables like wind and solar, but what happens when the sun isn't shining? Is nuclear an alternative? And if you'd like to turn on your video and unmute yourself, Dr.
All right. There we go. Thanks for that question. There's many answers to this. First, there are actually other types of solar than the photovoltaics. We have another type of solar called solar power towers or heliostats, and they are composed of thousands and thousands of mirrors that focus sunlight and the heat of sunlight up to huge towers, 400 or 500 foot high towers that encompass or enclose molten salts, which absorb the heat, and they're high intensity heat. They concentrate it, and then those can be used to then drive turbines which produce electricity. So that will then be good when we don't have the sun shining. They can be used overnight or over several days because the heat is retained in those molten salts. That's one alternative. Another alternative is that we have now grid scale battery systems that basically are built for entire communities, thousands of homes. And this is a new technology that's coming on board. And those grid scale battery systems, the first one was done by Tesla in South Australia. And there's about 8 other companies right now that are developing and building and supporting grid scale battery systems. So those are 2 alternatives to solar when the sun isn't shining, but also to collect the electricity and store it till we need it. In terms of nuclear, I still have major concerns with the risks of nuclear because, number one, we have terrorists, which could wipe out a system. We have natural disasters like what happened in Fukushima. And basically, we still don't have a way to neutralize radioactivity. So there have to be stored somewhere. And the storage of long-term radioactive particles still has a lot of risks associated. So I'm not keen on that. There are other types of nuclear, but they're not really well developed yet. So there you go.
Great, thank you. And then a lightning round question, answer in 15 seconds or less. Could carbon pricing be done at a local level?
Who's that for?
That's for you.
That's for me. Can it be done at a local level? Well, California has a pricing structure for, what do we call it? Cap and trade. So I don't know how local level do you mean, but our state is doing a type of carbon pricing. So it's hard because we have to encompass all of the different components and even stuff coming in from other countries. So we have border problems as well. So locally, yes, but to solve the global problem, we need everyone to be participating.
Thank you. And I'll pitch it back to Philip with that. Appreciate it.
I'm going to hand it over to Will Barrett from the American Lung Association for a presentation. Will works on clean air and climate change policy in California, focusing on vehicle emission standards, smart growth, and clean energy and fossil and fuels policies. Since joining the American Lung Association in 2009, he's represented the American Lung Association before state legislatures, as well as federal, state, regional, and local agencies engaged in clean air and climate policy. In this role, he supports the American Lung Association's clean air and climate policy efforts across the country. So with that, I will hand it over to Will Barrett.
Thank you so much. I really appreciate the opportunity to be part of the great program today. I definitely, took a lot in the first presentations and really appreciated the Congressman's comments to start the event. Philip is going to show slides for me and we'll walk through those fairly quickly, but this is basically an update on the American Lung Association's annual State of the Air report. This report came out just last week. It's our 22nd annual report. We can go to the next slide. And what we try to do with this report every year is really try to put air pollution issues in everyday language that are very relatable. It's essentially a report card. And what we try to do is focus attention on 2 of the most widespread pollutants in the United States, being ozone or summertime smog or particle pollution, which you can think of as soot, which comes from a variety of sources I'll touch on in a bit. Basically, we take air quality monitoring data from US EPA, convert that into a grading and ranking system for counties across the United States that have pollution monitors, and then look at metropolitan areas and rank those so we can kind of get a sense of where different places are in comparison to others in terms of unhealthy air or healthy air. Next slide, please. What I wanted to kind of highlight here really quickly is that air pollution is driving a lot of negative health impacts. You can see here, there's a lot of different ways that air pollution can harm health, ranging from wheezing and coughing, shortness of breath, to asthma attacks, to lung cancer. And unfortunately, in California, approximately 7,500 premature deaths every year are attributable to air pollution. So you see this is a wide range of health consequences. It's not just, I can't go outside. It's, this can lead to significant health emergencies, and in a lot of cases, unfortunately, to premature deaths. Next slide, please. On a national scale, our 22nd annual report found that while we've made a lot of progress under the Clean Air Act over the course of the 50 years of the Clean Air Act, the 22 years of our report, we're still showing over 40% of all Americans living in a county that receives a failing grade for either ozone or particle pollution in our report this year. In California, unfortunately, that number is 98% of all Californians live in a county where either ozone and or particle pollution gets to unhealthy levels. So a significant challenge here in California. I think Matt talked about the need for California's Clean Air Act authority to set stronger standards, and we're definitely supportive of that effort to make sure we can move California as rapidly as we can to cleaner air. Next slide, please. So here, all of that was sort of like the big picture, but this is really who is the most impacted. In our report this year, we found that a person of color is 61% more likely to live in a county in the United States than a white person would be. For a person of color is over 3 times more likely to live in a county that has a failing grade for unhealthy ozone days, unhealthy particle pollution days, and annual levels of unhealthy particle pollution. Those are our 3 categories. So it's an opportunity for us to all understand that pollution burdens don't fall equally across all people. There are significant disparities in exposures and significant disparities in health outcomes, negative health outcomes associated with air pollution. Next slide, please. Central to the discussion today is the impacts of climate change on our air. And the 3 years that we looked at in this year's report were 2017, 2018, and 2019. And that makes up the air quality data set. Basically, what, as you saw earlier, those are 3 of the 6 hottest years ever on record globally. During our report period, we also had some of the largest wildfires in California history that really had an impact on the air we breathe, the grades, and the ranks in our report. So again, climate change is first and foremost a public health challenge. It's making the job of cleaning our air much more difficult. It really speaks to the need to address both air pollution and climate change simultaneously. Next slide, please. Locally, wanted to highlight kind of where Sacramento falls in all of this. So the Sacramento metropolitan area, which is broader than Sacramento City, ranks on all 3 of our top 25 lists for most polluted cities in the United States, and 6th for ozone pollution this year. And that's not great news, obviously, but there is good news to share that the Clean Air Act, and so federal, state, and local programs have helped to cut unhealthy ozone days in Sacramento by about half since we started doing our report. There's still a long way to go. We still have a high ranking here in Sacramento, but we have seen progress, and that speaks to our policies are doing the work they're supposed to do. Next slide, please. So for short-term particle pollution, Sacramento ranks 10th in the country for unhealthy particle pollution days. And really, this is a Western US issue. You see here on the right side of the slide, only 2 cities outside of the Western US appear on our top 25 list. And ultimately, wildfires, drought, those are conditions that are made worse due to climate change and are contributing to higher particle pollution levels in our region. Next slide, please. For annual particle pollution, Sacramento doesn't make the top 10, but it's ranked 24th in the country. So it is on our most polluted cities list. And it's 24th in the country for annual levels of particle pollution. We are now passing or attaining the annual particle pollution standard, which again, it's good news. We've made a lot of progress, but we know that there's still a particle pollution challenge across the Western US. Next slide, please. So again, very briefly, the Clean Air Act is working. It's driven significant improvements over its 50-year history, saving millions of lives, trillions of dollars, because we've cleaned up industry, transportation, and we're doing a lot of good work under the Clean Air Act, and it's why it's so important that we continue to support the Act as one of our key public health laws in this country. But again, climate impacts are making the job of maintaining that progress under the Clean Air Act that much more difficult. Next slide, please. So I think I can actually end on the next slide. We'll go to one more just for time. I wanted to kind of leave you with this kind of key message and an opportunity for engaging in some of the advocacy that we're working on. Really, too many people across the United States on too many days of the year are breathing unhealthy air. Unfortunately, we know that too many of those people are people of color. There are disproportionate burdens in too many communities. And what we're calling on President Biden is to really advance environmental justice and to prioritize cleaning up pollution in communities that are most overburdened through investments that will drive the zero emission transportation technologies, renewable energy, these benefits in communities that have been most underserved and most over impacted by air pollution historically. So I have a link here to the report, lung.org/SOTA. There's a petition on that page, and encourage everyone to take a look and really to keep track of where our air is, what's coming, and what policies we need to advance the goal of everyone breathing clean, healthy air every day. So with that, I think I can wrap it up and turn it back to Philip.
Well, thank you, Will, for that presentation. There's time for one question. That being, to you personally, what was the biggest surprise in this year's State of the Air report?
I think probably the biggest surprise was that statistic about the Western United States, again, having such a heavy impact from unhealthy particle pollution days. And I think to put a really fine point on that, historically, California cities have dominated the top 10 list for ozone or particle pollution. And this year in the report, wildfires in Alaska in 2019 actually launched Fairbanks, Alaska to #1 in the country for unhealthy particle pollution days. And I'll just kind of preview next year's report. When we start to see the impacts of that 2020 wildfire season that happened in California, I really do, the list will reshuffle based on just how devastating the wildfire season was in 2020. And, as well as, being tied for the hottest year on record. So we know that, the wildfires, extreme heat, these are kind of driving the conditions for poor air quality. And again, it really speaks to the need for more conversations like this that Congressman Bera has so kindly pulled together to share this information and really put a fine point on it. So it's an important question, and I look forward to the conversation to come.
Well, thank you, Will, and keep up the great work.
Thanks, Adrian.
So at this point, we will transition to our health experts. The first of which is Dr. Lee Balance. Dr. Balance trained in adult internal medicine in Chicago in the South Bronx. After moving to California in 1976, he worked as an emergency physician in Salinas, Berkeley, and Hayward before moving to Kaiser Vallejo, where he finished his career as a musculoskeletal specialist and medical educator. Since retiring in 2013, he's been an active climate action advocate as a member of Citizens Climate Lobby and of CCL's Health Action Team. He has one daughter and an 8-month-old grandson. Dr. Balance, why don't you take it away?
So I'd like to begin by thanking Congressman Bera and his staff for the opportunity to speak to you today. I believe that the climate crisis is the defining issue of our time, and that its impacts on human health are one of its most dangerous aspects. Now, can I advance the slide? Having trouble seeing the slide advance here. Good. Climate change affects many aspects of our health. Today, I will be highlighting the key impacts in the Sacramento Valley region as outlined in California's latest climate change assessment. Heat effects are the most damaging impacts of climate. Its yearly death toll is greater than that of all floods and storms combined. Heat temperatures, especially sustained day and night elevations, can overwhelm the body's protective mechanisms and kill people. Remember that we're adapted to the climate that we had for the past 800,000 years, and we're pretty finely tuned to that. Those who have chronic underlying lung or heart problems or diseases such as diabetes are particularly susceptible. As the climate crisis progresses, we will be subject to more serious and prolonged heat waves, along with generally higher day and nighttime temperatures, as we've heard. And these risks are not equally distributed. Higher risk individuals include young people, especially the very young and our outdoor athletes, senior citizens, those with chronic physical or mental illness, pregnant women, outdoor workers such as agriculture and construction, and the poor and unhoused and minorities who often lack resources such as air conditioning are all at increased risks. This chart shows the number of 5-day heat waves. I think I just lost. Okay, I think, Phil, do you have my slides? Okay. Go ahead. Great. This shows the number of 5-day heat waves predicted for the Sacramento area from 1950 to 2099. Currently, heat waves occur less than once a year, maybe every 2, 3, 4 years. By the end of this time period, they would be seen as many as 5 times a year, and assuming that no actions are taken to reduce greenhouse gases, currently we're about in the middle of this graph. And this graph counts a heat wave as 5 days of projected very high temperatures. Next slide. And next slide. As an example, yes, in 2006, the state of California suffered a sustained heat wave that lasted over 2 weeks. This resulted statewide in some 16,000 excess deaths. 16,000 excess emergency room visits, 1,100 hospitalizations, and at least 600 deaths. The marginal cost was estimated at $5.4 billion, and the highest impacts were seen along the coast and in the Central Valley. Next slide. Well, burning fossil fuels causes air pollution as well as driving climate change. Air pollution is estimated to cause about 18,000 deaths per year in California. Ozone and particles, or soot, are part of the air pollution. Both ozone and soot worsen many chronic problems, including lung and heart disease. Higher temperatures will increase ground level ozone, even if greenhouse gas levels fall, and wildfires caused by climate change will increase these particulate levels. Allergies and hay fever seasons will lengthen and worsen. Next slide. So this is a picture of the multiple effects of indoor air pollution on the human body. As you can see, almost every body function can be adversely affected by air pollution, including the lungs, the heart, the brain, blood vessels, and metabolic and reproductive systems. And all of these effects are being worsened by climate change. Next slide. And that's not all. Both droughts and extreme precipitation are predicted to occur. This can lead to injuries, and floods can lead to injuries and mold growth due to flooding when we have too much rain. Shortened winters, decreased snowfall, and drought can lead to water shortages and crop damage, which can result in dehydration, kidney damage, food insecurity, and hunger. Infectious diseases can spread, with West Nile virus and valley fever being expected to be the main issues in the Sacramento area. Mosquitoes, ticks, and other disease spreaders are expected to increase their range and lifespan, and we're beginning to see more tropical diseases in the southern part of the state. Climate change also takes a big toll on mental health, which you'll hear about more in Dr. Cooper's talk. Next slide. Climate crises impair our ability to provide care. Facilities can be overwhelmed by a sudden upsurge in people needing care during emergencies. They can be knocked out of service by smoke or damaged by fires or storms. As an example, the Kaiser Hospital in Santa Rosa has now been evacuated twice due to wildfires in the past 4 years, and in each case had to be completely restocked due to smoke damage. Climate crisis affects also displaced populations, as Representative Bera said. Many people lost homes and have had to relocate due to the California wildfires. In the instance of Santa Rosa Kaiser, I know that 77 physicians lost their homes, and that's just physicians and just Kaiser. Farms in Central America have failed due to drought, and their families have moved to seek better lives elsewhere. And much of the migration in Southern Europe has been attributed to climate change. Next slide. So, is there really any hope? Well, we know that reducing fossil fuel use can improve both air pollution and greenhouse gas emissions. And actions such as active transportation, like biking and walking, and plant-based diets will improve health while reducing our greenhouse gas footprint. We know that lung function improves when air pollution lessens. And we know that through the climate investment program, which is part of the cap and trade program, that a recent study shows that the value of the benefits is 5 times the cost of the program. So I think that's all I have to say for now, and I'm happy to entertain questions later. Thank you very much.
Thank you, Dr. Balance, and looking forward to the moderated question and answer session to come. So the next person I'd like to welcome is Dr. Kent Pickerton. Kent Pickerton, PhD, is director of the Center for Health and the Environment. He's a professor of pediatrics in the School of Medicine and professor of anatomy, physiology, and cell biology in the School of Veterinary Medicine at UC Davis. His research is on air pollution, climate change, and health. Welcome, doctor, and please begin with your presentation.
Well, thank you very much. I very much appreciate Congressman Bera and this opportunity to talk about climate and health. I serve as the director for the Western Center for Agricultural Health and Safety, which is one of 11 agricultural centers across the country. And our interest is very much focused on climate issues, as well as other health and safety issues for our workers in agriculture. One of the concerns that we really do have, and I think it's been brought up very nicely, is the fact that climate can be in very different forms. We can have excess rain with flooding, or we can have heat waves with very significant consequences. We've also talked about the importance of climate and how it may drive drought, as well as dust, and the harmful effects of airborne particles in the air. I'll focus much of my talk on wildfires and just how they are impacting. In terms of California wildfires, as we've heard, we see that they're increasing in frequency and in severity. While wildfire smoke is dependent upon geography, weather, and wind patterns, a lot of what we are seeing is that areas that are most affected by the number of days of smoke exposure are often dramatically greater than the areas directly burned by the wildfires themselves. This is a wonderful photo by Stephanie Rodriguez showing workers in the field during a wildfire event. This was prior to the California regulatory policy. If you'll notice closely, none of the workers in the field have any kind of personal protective equipment or face masks, in spite of the fact that it's a harvest time and they went out without even concerns about the wildfire event itself. I wanted to show you this map of California. On the left, it's really showing the darker green you see are areas that are significant in terms of agricultural productivity. On the right is the Cal Fire incidents in 2018. And there's a very significant overlap between our agricultural regions and where wildfire events have occurred. And this is, as you can see, throughout the entire state of California. One of the things that we really realize that wildfire smoke can be transported over many, many miles. This is a November 2018 image on the left of the Bay Bridge and wildfire smoke that was coming from Paradise, California, as part of that campfire devastation, which literally destroyed the town of Paradise. On the right, we see a more normal day of what the landscape and the skyline should look like. Well, what are the components of wildfire smoke? We've heard a little bit about this, but we have both gases as well as particles. Some of these gases have been mentioned as greenhouse gases, oxides of nitrogen, carbon monoxide, carbon dioxide, methane, but we also have such things as dioxins, which are known to be carcinogenic, as well as volatile organic compounds, VOCs. In terms of the particles that can be emitted, whether it be just typical vehicular pollution or wildfire smoke, these are very tiny particles. As was mentioned, PM10 are particles that are less than 10 microns in diameter, and particles that are less than 2.5 microns in diameter are referred to as PM 2.5. This image on the right is through the US Environmental Protection Agency, just to help us see this. That's a single shaft of hair, and just to show how tiny these particles are. And particles that are PM 2.5 are highly respirable. This is something that we're very much interested in. Again, we know that PM levels, particulate matter levels, go up during wildfire events. And this is actually an illustration to show what we were measuring in Davis from the Paradise, California fire in November of 2018. This dark line is actually showing the levels or concentrations of PM 0.1, very tiny particles, during this period of roughly from the 13th through the 23rd of November. The wildfire event and the wildfire smoke was pretty much gone by the 20th of November. In terms of chemical composition, these brown bars here are just showing what proportion of the PM is consisting, and this is fresh smoke, this brown material. But as we go on, we see that we're beginning to see these brown and kind of a lime green color. These are aged smoke particles. So these are actually changes that are occurring in the chemical composition of the smoke as it is transported, and over time, the changes that are seen. What I wanted to point out is this kind of dashed silver line that we're seeing here. And this actually represents burned plastics or phthalates that are present in the air. So with wildfire smoke, it's not just vegetative burning, but also the loss of structural buildings and their contents. And these are plastics that were actually measured in Davis, which is about 100 miles away from Paradise, California. So what are the effects, the health effects of wildfire smoke, and also which pertains to any kind of particle pollution? That these short-term effects can be affect the eyes as an irritation or burning sensation, runny nose, chest pain, or actually fatigue that one may experience. Coughing is typically associated with the wildfire smoke, as well as difficulty breathing, or even a change in heart rate, as well as headaches, wheezing, and dizziness. Well, these are the short-term effects. What about long-term effects? So these have also been mentioned briefly, that we really can see an exacerbation of pre-existing cardiorespiratory problems that include asthma, chronic obstructive pulmonary disease, or cardiovascular dysfunction. Many people experience chronic bronchitis or inflammation of the airways that can be very irritating. And in some instances, we can actually see individuals who have heart failure or premature death. So the California regulatory protection for wildfire smoke was adopted in late July of 2019, in which employers of of individuals who work out of doors, so this would be agriculture or construction, that they need to monitor the air quality index for PM 2.5, train workers, establish worker protection procedures, and communicate workplace procedures, and then provide for face masks or respirators, preferably the N95, when PM 2.5 exceeds this air quality index of 150. So as part of our center, we were very much involved in assisting in trying to provide training materials and guidelines for both the employer in terms of a checklist, as well as a guideline for the sorts of things that employers need to do to comply with the California Wildfire Emergency Act. We also provided training materials that are visual to help people understand about health effects of wildfires, how they monitor for the air quality and sites that they can go to, and how is the proper use of respirators, what should be done, what is important, and then what should we do at the work site as reminders of protecting these individuals. So I wanted to just present that. These materials are all available, downloadable at our site for our ag health at ucdavis.edu wildfires. And I'd like to thank Heather Ryden, who is a member of our ag center, who is involved in our as our program director. And I'll turn it back over to Adrian.
Thank you, Doctor, and looking forward to the Q&A. Reminder to folks that if you do have questions for any of the health experts presenting right now, please do utilize the Q&A function at the bottom of your screen, whether you're on a desktop device or a cell phone. So last but not least, I'd like to welcome Dr. Robin Cooper. Robin is a clinical associate professor at the University of California, San Francisco, and treats patients in her private psychiatric practice, also in San Francisco. She's been a climate activist for over a dozen years, including an active member of the San Francisco chapter of Citizens Climate Lobby. As a physician and psychiatrist, she's very concerned about the health of mental health and mental health impacts of climate change. She is also co-founder and president of the steering committee of the Climate Psychiatry Alliance, a national organization with a mission to educate and advocate about the mental health impacts of climate change. You can read more about that effort at climatepsychiatry.org. Welcome, Robin.
My name is Robin Cooper. I'm a psychiatrist in San Francisco and one of the co-founders of a national group, Climate Psychiatry Alliance. I'm here to discuss some of the mental health impacts of climate change and hope to bring some of these important ideas to you. It's through our thoughts and our emotions that we experience and make sense of the aspects of our existence in the world we live in. So I think that the mental health components are key for all of us. Next slide. I'm going to go through these very quickly, but speak about the mental health impacts and cover impacts on heat, disasters, displacements, the new areas of eco-distress, and also briefly talk about the impacts on vulnerable populations, who those are. Now, heat waves, next slide, are serious risks to health and mental health. So I'm going to look particularly at sleep for a few minutes. They represent the greatest morbidity and mortality of all weather events. But we can manage some of these. Seeing the heat waves have huge impacts on all of us and impacts on our emotional lives. Next slide. We're seeing heat waves in every area, from places where it's very warm to temperate climates. And you in Sacramento, as others have already spoken about, are not have had a big taste of the heat waves last year, when temperatures reached 112 degrees in Sacramento and 8 days of over 100-degree weather. Heat has very specific impacts on behavior, mood, thinking, sleeping, and impacts on our ability to sustain our body temperature when using certain medications. Next slide. Well, all of us know and experience being cranky and kind of having temper tantrums or flares or feel irritable or listless on days when it's really hot. And our colloquial language expresses this: hot-tempered, simmering anger, so angry my blood can boil, or the admonition to, hey man, chill out, chill out. The next slide. But extreme heat impacts go way beyond crankiness, with significant impacts on mental health and behavior. We're seeing an increase in violence. And of course, violence is multifactorial, but there is good mounting scientific evidence that extreme heat is a contributor to violence, both interpersonally and intergroup violence. This is found all over the world, and we're beginning to get some understanding about the biological contributors to this. And I am particularly concerned about the impacts of this on women and children and domestic violence. Next slide. Suicide also I consider this as aggression turned toward the self. Again, not a simple behavior and many contributors, but there is again mounting scientific evidence that heat alone is contributing to increases in suicide, and of a substantial amount. One of the best researchers in regards to this estimates that by mid-century, there will be an additional 21,000 suicides due to heat alone if we do nothing to curtail CO2 emissions as the driver of increased heat. Next slide. And of course, those things that we all experience: trouble with concentration, difficulty thinking, not learning so well, and not paying attention to complex tasks as well, and trouble sleeping. And there's even increased depression. These can be bothersome to all of us, but they're very significant health concerns to those who are vulnerable. Next slide. And I need to be a conscientious psychiatrist and let you know that the medications in our armamentarium interfere with the body's normal heat regulatory mechanisms and sweating, and that there are many non-psychiatric medications that also have an impact. Next slide. And those who live in dense cities experience the heat impacts much more profoundly, since our cities have hardscapes and lack green planting and can create up to 10 degrees hotter temperatures than in the suburbs. And this impact is very significant for urban poor with substandard housing who often lack air conditioners on top of the general urban heat impacts. Next slide. Disasters. Disasters are of great concern, and climate disasters vary very much by region and are locally determined. Floods, hurricanes, extreme heat and weather events are acute disasters. Slow-moving disasters, often contributors to acute climate disasters, such as the droughts that have already been mentioned. Now, no one in California can escape the awareness of our local specific disaster, wildfires. And there's already been a good deal of attention to this, but we lost an area equal to Rhode Island in the fires last year. Next slide. Now, psychological responses to disasters have been extensively studied and are a guide to much of the governmental responses to acute disasters. Fortunately, for many acute disasters, the acute distress symptoms of anxiety, irritability, distraction, insomnia do spontaneously resolve. But there are also poor coping behaviors that people rely on with increased alcohol and drug use, and a burnout for those who are heroes during the acute phases. But there are significant groups of people who have severe risk for enduring difficulties. People who have sustained the most severe losses with death to loved ones, loss of employment or personal and financial losses, and are particularly vulnerable. These are considered complex traumas and can be profound. Depression, anxiety, and post-traumatic stress can be associated. Next slide. And disasters beget more health difficulties. Wildfires, as you've already seen, contribute to enormous air pollution, and others have spoken about the health impacts of air pollution, but I want to address specifically the brain impacts. Next slide. So we've heard about the lung impacts, but those very fine, ultrafine particles that have already been shown to you as very tiny, those 2.5 millimeter, can be directly inhaled through our olfactory bulb, our breathing apparatus in our nose, going directly to the brain and causing inflammation and brain cell death. Next slide. These can have a major contribution to neuropsychiatric disorders. They're not the primary drivers or the sole drivers, but are multipliers. And climate and air pollution is a contributor to dementia, which is a great concern both for the burden of illness and costs to society. The Lancet, which is a major British journal, is now listing air pollution as an official risk factor for dementia. There is some indication also that air pollution can cause increases in depression, a concern for those who are vulnerable. And of course, we're concerned about the impacts of air pollution for children, since the neurocognitive impacts are lifelong for them. Next slide. Now I'm going to talk very briefly about displacement, and I think Lee Balance has mentioned this. We're living in a world with shrinkable habitable space, and it is only going to get worse. The range that we are looking at of projections for displacement due to climate alone is in the 2 million people by mid-century. That's 1 in every 45 person in the world, tenfold increase of what today's immigrant population currently is. Next slide. And just to mention that displacement is not uniform. It occurs in temporary and permanent ways across international borders and within our borders and communities. And the concerns for driving socio-political instability are enormous. I'm very concerned about what we're now seeing as attitudes toward the newly displaced ethnic groups and triggering the kind of scapegoating, racism, and violence toward newly displaced people and amplifying underlying inequalities. Next slide. So I want to turn our attention to this new burgeoning field of eco-psychology, the emotional responses associated with the perceptions about climate change and about the world that we live in. These are considered psychoterratic syndromes, constellations of mental health impacts associated with environmental damage and the uncertainty about the future that we're going to live in. I call these emotional responses to living in a tattered world and confronting our unknown future. And many of us in my field are beginning to see more and more people with these presenting concerns. And I've listed some of those ways that we talk about that in this slide. Next slide. So anxiety is of great concern. And I want to just mention that this is not a pathological concern, that we should feel anxious and concerned and upset about real risks. And this is a mobilizing function. Again, just to show you that this is not equally distributed, and I will wrap up and just say that there are many ways, and if you'll bring me to the slide that says don't agonize, organize, it's a few down. You will notice that my prescription for responding to climate anxiety is to involve yourself with activity and engage with those political solutions. And two slides left. I will just thank the next slide, Congressman Bera, for his attention to this, and remind you he needs us to continue to talk with him about this issue. Thank you.
Well, thank you, Dr. Cooper. And in our final 10 minutes, just want to bring all of our public health panelists back. So if you could turn your video on, that would be fantastic, including Dr. Sukanik, who we heard from at the front end of the event. So welcome all back to the webinar. Just wanted to elevate a couple of questions in the time we have left. One being, you know, we're clearly still facing the COVID-19 pandemic, and curious about sort of the linkages between the health impacts of the COVID-19 virus and then the health impacts of wildfire smoke and how one might exacerbate the other. But also, so there's that linkage, but also, are we to expect more pandemics as a result of the climate crisis? So that's a two-parter. I don't know who wants to tackle it first.
I can start. I think there was clearly some data, I didn't go back and review it early on, that people who lived in areas of more pollution were more likely to have severe COVID infections. And I think it will take a long time to sort out the exact role of climate change in this pandemic, but most people predict that we will see more pandemics for a number of reasons. One is that we're a growing population, and we're growing into areas that where people formerly didn't venture. We're seeing people use more creative food sources, we might say. And we also are so interconnected that things spread incredibly quickly.
I would just add that I would agree with Dr. Balance on all that he said. One of the difficulties that we're experiencing right now with the COVID-19 and wildfires is what kind of respirator is one to be using. And they're very different in terms of basically a cloth face covering is good to prevent the personal spread of respirable aerosols from individuals, but they're not very good with protecting you against particles that may be present in the air. What is good is that I think there is a greater availability for personal protective equipment and face mask coverings. There's many different sources for them now, and they're also being provided through different organizational groups and through different state agencies as well.
Go ahead, Dr. Sukanik.
Yeah, it's very clear that as temperature goes up and sea level goes up and all of these other extreme impacts that we're experiencing, there's going to be millions and millions of people who are climate refugees. They're going to be displaced from their own homelands, from their own countries. They're going to be crammed into refugee camps. And with that close connection and the overcrowding, that's probably going to, if it doesn't start it, it's going to exacerbate the situation for any virus that's out there. That's something else to consider.
Go ahead, Robin.
I just want to add that the big lesson from COVID is how interconnected we are, how dependent we are on each other, and how we have to come to solve some of these problems as a whole international world. And that is the message for climate also. We have to learn it from COVID, and we have to apply it for climate.
And I'd just like to add that I'd like to go back to one of the original slides that showed the COVID crisis and the climate crisis. And COVID is a model for what we're facing in the future. Both our emotional responses, as Robin so eloquently spoke, but also the overwhelming of our medical facilities, which we saw with COVID, the depression and emotional damage to healthcare providers that's caused many of them to think about leaving the profession. I think as we think about COVID, we think about, well, is this the picture writ small of what climate change has in store for our future?
So keeping that in mind, and taking into account the eco distress that Robin talked about, I mean, is there an effort to, build eco distress into some of the curriculum, that's being taught and developed in our, our universities and our institutions? Is that an active effort?
First off, let me address, there are active efforts to build what are called resilient communities. And most people are familiar with the word resilient by the structures of how we build things in our communities. But there is active work around creating resilient communities of connectedness. That is a way to manage and also to help prevent some of the climate impacts. In regards to curriculum, there's very, very active efforts within my field and in the field of medicine per se to introduce the issues of health and mental health in curriculum for professional training. It is clear that this is going to be one of the most significant health issues going forward, and our health providers need to be trained to face climate issues, and that is actively going on.
I think there's one phrase that kind of epitomizes the relationship between COVID and climate change, and that is, if COVID is a quiz, climate change is going to be the final exam.
Will we pass the exam?
We'll see.
We'll see. So there definitely are efforts to include climate change in medical curriculum. At the AMA level, there's work at the CMA, California Medical Association level. There's articles in most of the major journals about why this is important.
I would agree with that. In the University of California system, all of the professional schools, the medical, dental, and nursing schools have come together to enhance their curriculum to discuss sustainability, environment, and climate.
And a lot of the energy behind this is from the students themselves, actively looking at the curriculum, looking at where this material can be integrated. The students, thank God, are going to lead the way.
So we also had a question, I think, as a result of Dr. Sukanik talking about, the need to electrify. We had a question about battery storage and just the need to build more batteries and battery technology. Are there concerns that you all as public health experts have with, vastly expanding the number of batteries and potential, environmental degradation that comes from mining, et cetera? Any concerns about that to one of the folks' points?
Well, the batteries are necessary for us to get away from the temporary sources of electricity, wind and solar, and they're being increased in terms of their efficiency. Last year, Tesla had a battery day, and I think their new technology is basically improving battery technology by about 20%. So we are making advances, and hopefully we can make advances also in the components that are used in the batteries that won't degrade our environment.
I'm going to say I don't know enough about battery technology. I haven't studied it. I've seen things about it, but I'd like to reinforce the point that energy efficiency, rather than saying, well, how can we keep doing everything we're doing and use the same amount of electricity? Every time we find a way to use less electricity, we solve a whole bunch of problems. And so energy efficiency, and in the En-ROADS thing, in the En-ROADS demonstration, it was more effective than electrification. So we have to keep our eye on the prize of reducing energy consumption and finding ways to live our lives in a good way with less energy in our homes, in our buildings, in our transportation, et cetera.
I think that point is well taken. Thank you for that. And then I think for each of you, I'd like to just ask, what is one simple action that folks on this webinar today can take in order to advance the cause of both public health and addressing our climate crisis? And maybe I'll start with Robin.
What I ended with, the most important thing is coming together as citizens, asserting your political voice and efforts so that there are policy solutions. There are many things we can do as individuals. There are many ways that I can contribute to the health things with my patients. The most important thing is affecting policy.
And Kent.
Well, I would agree with what Robin has said, but I'd also add that we really need to have this means of communication and basically a partnership of working together, be it employer or worker, and making people aware of what they can do and how they can protect themselves. I think that's so important to have that kind of learning and training and available, that we just communicate with one another.
And how about Tom next?
Yeah, I have a list of 50 things on my website that each individual person can do. They're all kind of minor things, but it's, you know, kind of a feel-good kind of list. However, the most important thing, I also agree, is to get out there and vote for every local, state, and national election that you can, and put your heart into it and figure out your candidates and get out there and express your opinion.
And last but not least, let's hear from Lee.
One thing? Oh. Well, Catherine Hayhoe always says the first most important thing we can do is to talk about this, that people just don't hear about it enough. And if they don't hear about it, they don't see it as an issue. So I echo that, communication. And then I think you have to say, what do I care about? You know, do I want to work at my school level? Do I want to work in my community? Do I want to improve bicycle transportation? And do I want to work on federal policy? Do I want to work on local? You have to look at where your energy is and what you feel good about. But action is the antidote to despair. I agree 100% with Robin.
One more additive here. I think it's important that we also educate ourselves and the people that we hang out with, our peeps, and make sure that they, you know, are educated to the point where they can make rational decisions on where we should move forward.
Wonderful. You get the last word, Lee.
Well, I was just going to answer. I was going to answer one question that comes up that just came in on the question line, which is overpopulation is never addressed, but isn't this one of the primary causes for the climate crisis? And I never know quite what to say. I will say that my grandchild is going to consume way more power than the grandchild of someone living in India today. So there's this inequity in the overpopulation issue. But I'm also going to say that Project Drawdown defined the two things that can most effectively reduce carbon generation. And it's educating women and providing reproductive control services. And so that shocked me when I heard that. But when I think about it, I see it, that education about birth control and general education and promoting women in societies is incredibly effective in reducing carbon consumption.
And I just want to jump on to what Lee said. That's really important. And when you asked us, Adrian, what's the one thing, you kind of pushed us into a corner. And I started, and we should end with, there isn't one thing. It's the combination of the many. And I think that that's also really important.
Wonderfully said, and just want to thank you all for really being able to convey a ton of really insightful information in just a number of short snippets. So really appreciate your time today, and for, again, thank you to the Congressman for getting us all together. And with that, I will pitch it back to Philip Norton. Thank you all so much again.
Thank you.
A couple slides with some information right now, and look forward to all of you joining us for our future events.